helping you to weather good and bad economies without putting retirement on hold. This is the Tumolo Financial Podcast with Ken and Nick Tumolo. Ken and his son Nick know that creating a comprehensive financial plan can align your hard-earned life savings with your retirement goals. Consider them your retirement architects. Now, the Tumolo Financial Podcast with Ken and Nick Tumolo.
All right, Alyssa, you're up. Something else that can throw a lot of Americans is the medical costs that we need to manage ourselves in retirement. We're no longer have our employer with our healthcare benefits built in. We got to figure it out ourselves, but not by ourselves. You're here to help. Millions of Americans, of course, rely on Medicare for health coverage during retirement. But it's odd and it's upsetting how little we seem to know about how the program actually works. There was a survey done by Nationwide that revealed 79% of pre-retirees think that Medicare Part B is free to workers who pay Social Security taxes for at least 10 years. Not only is Medicare Part B not free, but it's one of many things you will need to pay for under Medicare. So let's talk about, and if you want to give more details on that you want people to know, but just in general, Medicare costs that tend to catch retirees off guard the most. What do you see?
Yeah, and I'll pick on my mom for a second. She was one of those 79%.
I mean, that's a huge percentage of Americans, though. I mean, this goes back to the thing that we always talk about, the lack of financial education that we as a country deal with.
Yeah, and I think you see those taxes come out and go into Social Security for so many years of your paycheck, and you think Medicare is going to be free, or we're somehow under the assumption that, we get older, we retire, and our healthcare is going to be covered. And unfortunately, that's not the case. And so Part B, the standard current premium for 2025 is $185 a month. That does go up based on your income if you hit a certain threshold. So it can be costly, and we do want to, just be aware of where those income limits are, and what maybe we're doing that could impact those limits in the future, and maybe increase our Medicare premiums in the future. And that's something Ken and Nick help with all the time with people. But the reason also why you do need Part B, if you're eligible and if you're not working and don't have other healthcare coverage, is that you can incur a penalty if you don't get it. So if you don't have,
not only is you have to pay for it, it's not free, but if you don't get it, you're going to be penalized for it. Man, it just keeps adding
lifetime penalty. You can't get away from it. So so you don't want to make that mistake. That goes for Part B and D.
Okay.
You can incur penalties for those. So if you don't have creditable coverage through your employer, which that's something also people get nervous that they're still working and they're going to incur a penalty. Don't worry. If you're still working and you have creditable coverage through your employer, you're not going to incur that penalty. You just need that documentation from your employer saying that, you have that coverage. But then once you're eligible and maybe you retire, you're going to want to sign up for Part B because you just don't want to incur those penalties. So that's one cost that people aren't aware of, is the penalties, and those things can creep up on you. Part A that's hospital care. That is generally free to people that have worked 10 years or more and been contributing into the system in the U.S.
Okay.
There are some different premiums that they kind of subsidize if you've worked less than that. And there's a formula for that. But for most people, that's free. But there are deductibles and co-pays and co-insurance for Part A. So it's not completely free. You're not going to go into the hospital and not have any bills. There are deductibles that you need to meet and things like that.
Okay.
And then the Part B, which we just talked about, that's your doctor's visits, screening tests. That's like your outpatient medical care. So there's a premium for that. And there are some deductibles there's a deductible for Part B as well. So those are original Medicare, A and B. Okay. And then you have, add-ons. So Part D, like I said, that's your prescription drugs. You can incur a penalty for that too. So I do, and I've had this conversation with people who come in and say, well, I'm not on any prescriptions. I don't need Part D coverage. And I understand where you're coming from, but 5 years down the line, if you go on a prescription and you need that coverage, then you're going to get penalized. So it's better to just have that coverage, satisfy those needs so you don't get penalized.
Yeah.
Even if you're not using it, it will just help you in the long run.
Okay.
So Part D is not provided by Original Medicare with the government. That's with a third-party insurance company, a private insurance company. So it's shopping those and seeing what prescriptions you're on, what your costs on each, insurance company would be, and seeing what fits your needs. And all the different companies have formularies. So one drug on insurance company A might be more expensive than on insurance company B. And then you also want to be careful with deductibles and things like that.
And that's where you come in as far as like helping us shop those companies, because that can get very confusing and overwhelming. And so we can come to you and say, okay, these are the medications I take and this is what I'm concerned about. And you can say, all right, and you'll go to work and you'll present those options to folks.
Exactly. So what I do for people is you come in, you give me your list of doctors, prescriptions, what your needs are, what
Save
you
space,
like.
But you have to give Alyssa the information. She needs to know what's going on. Yeah.
Yes. Yeah. That's the only way for me to give you, a good comparison.
Right.
And then you can tell me, what you like about your current coverage, what you don't like, and we kind of just go from there. So I'll run comparisons side by sides, and I'll present you with some options. So that is something that we do complimentary. You can call 860-854-3434 to sit down with me and kind of go over your options, or you can go to tfcheckup.com. And there's a lot of, costs and things that maybe people don't know. The other thing that I have heard, and I just want to mention this too, is maybe people, sometimes they come in and they're surprised at maybe that it's a lower cost than what they're paying now.
That's good.
On
We
Medicare.
like those surprises. It's not always bad
That can be
news.
the case.
It's not always bad news. Yeah.
And especially when you hear horror stories from neighbors or friends and they're like, I pay this much. And you don't know what their situation is. You don't know what their health conditions are, what medications they're taking.
Yeah.
So people are surprised. I had someone last year, he went in for a knee replacement and he was happy because he got a $395 bill for the whole thing, the whole surgery and everything.
Yeah.
So, don't also be scared. It could work in your favor too. It's just knowing your options.
Well, and as we've been saying, you're here to help us remove the fear, empower us with information, and also understand what our options are, because and we talk about this almost every week, retirement, it just gets more and more complex, which is why even if you were a great DIY investor in your working years, we believe it's really important to have somebody guiding you through the financial process of your retirement, because there's just so much to figure out, as we were pointing out, just with Medicare alone. So if you have questions, we're here for you. 860-854-3434 is that number to dial if you are ready for your own Tumolo Financial Retirement Checkup, one that includes a Medicare review of your options and what you can put into place for your medical future, your medical care. Alyssa's here for you. The entire team is. 860-854-3434. You can also visit us at tfcheckup.com. 860-854-3434.
Investment advice offered through Tumolo Wealth Management, a Connecticut-registered investment advisor. Content contained herein should not be construed as an offer or solicitation for investment advice or for the purchase or sale of any security, insurance, or other investment product. Please consult with a qualified financial, tax, accounting, or legal professional before implementing any ideas or strategies discussed here.